Hi everyone, welcome back. So let's start with our Aeon topic, people not professionals. So we have to start from the new series, which is at Bicytre recovered mental health patients were employed as staff to take care of patients. So let's see what this series is trying to tell us. So let's start with the first basis. In our work, we address these realities by developing evidence based and innovative mental health and suicide prevention program based on peer support and they lack counseling. These programs are usually delivered by community members, persons with lived experience, caregiver, youth, health professional, or other group using skills that they have developed through the training and mentorship our programs provide. So it's basically introduction about the program on mental health. So which just provide a live experience caregiver, youth, health professional or other group using skills that they have developed through training and mentorship. And this program, how it can help developing innovative mental health and suicidal prevention program based on peer support and lay counseling. So the title of this whole passage is Introduction of Mental Health Program, and what we can just take from here is that developing evidence-based and innovative mental health and suicide prevention program based on peer support and lay counseling. That's all for this passage. Let's moving toward the next one. In the context of mental health, peer support is a process through which people who share similar lived experience or social background, support other experiencing mental health problems, or emotional distress. One of the earliest record instances with psychiatric setting can be traced to the late 18th century at the Bicêtre Hospital in Paris, where the recovered mental health patient were employed as a staff member to take care of the patient who were in treatment. Other earlier manifestations of peer support emerges as self-help groups providing informal support in the community. For instance, in 1845, a group of men who had experienced treatment violation while in an asylum set up an Allied Lunatics Friends Society in England which fought for protection from unjust confinement and from cruel and improper treatment. So basically, this passage is talking about how this program works and who run this program. So the title of this whole process is the whole passage is how the mental health program works. And what we can take from here is that peer support is the process through which the people who share a similar lived experience or social background support others experiencing mental health problem or emotional distress. Manifestation of peer support emerges as self-help group providing informal support in the community. That's all for this species. Others are the examples of societies organized by or started by various peoples in various other places. So let's start with the next species. Another early example was Alcoholic Anonymous, set up in 1935 in Ohio in the United States to support people struggling with alcohol addiction. AA is now the present across the world and is widely regarded as one of the most successful peer support group specifically for addiction recovery. So we don't need to just put the title and the take important point from this species. We just summarize the species that there is one program one initiative which is known as Alcoholic Anonymous AA, which is set up in 1935 in Ohio for helping the people or supporting the people who are struggling with alcohol addictions. So let's moving toward the next phases. However, it wasn't until the 1970s that peer support as a formalized and systematic approach emerged out of the service users survivor movements, which, along with the anti psychiatric movement, challenged mainstream and formal mental health service driven by the psychiatric model. This was alongside other social movements for civil rights, women's rights, LGBTQ plus rights and disability rights during the 1960s and 70s, which also influenced the development of peer support in the context of emerging discourse on human rights and resistance against oppressive systems. In particular, peer support began to embed itself in the recovery movement, which foregrounded the voices and agencies of persons with lived experience and services users to shape and pursue their own idea of recovery, hope, and functioning without reducing their identities to their diagnostic level and symptoms. So, this is the example. This is the paragraph. The whole paragraph is saying how the person who are just victim take use of these programs. How these peoples support them. And this is the talking about the different movements. So basically, the title of this whole passage is Different Mental Health Movements. And what we can take from here is that in sorry in 1970s there is a movement called service user or survivor movement, which is along with anti-psychiatric movement challenged mainstream and formal mental health service driven by the psychiatric model. There is many other movements like civil rights movement, women's right, LGBTQ right, and disability right during 60s and 70s. It's in 1970s. So he said there is all various movements. These movements influenced the development of peer support in context of emerging discourse on human rights and resistance against the oppressive system. And there is another movement which is called recovery movement. It is a voice and agency of person with a lived experience a service user to shape and pursue their own idea of recovery, hope functioning without reducing their identity to their diagnostic levels and symptoms. So that's all for this passage. Let's moving toward the next one. To understand the basic principles of peer support, you might be able to refer to experience in your own life. Most of us at some point have provided emotional supports to a family member, loved one, or acquaintance in a familiar setting. In such moment, we might have found ourselves drawing upon our own lived experience and sharing insights on how we coped in those moments, both of which are key element of peer support. So it is just a description about who are supposed to be the part of these kind of movements to helping others who are just sufferers. So what we can so the title of the whole passage is who are the supporters? Who are might be a supporters, and what we can take from here is that able to refer to experience in your own life. Might have found ourselves drawing upon our own lived experience and sharing insights on how we coped in those moments, both of which are key element of peer support. So those are the people who are eligible for the peer supporters. Let's moving toward the next business. A couple of years ago, one of us, AK, received an urgent phone call from a young man we called Ajay via LGBTQ plus network. Ajay identifies as a part of LGBTQ plus community. He was unemployed and hence dependent on his family, but said his family member would subject him to physical and emotional abuse. On that particular day, traumatized by their violence, Ajay was confronted by intense thought of ending his life and immediately reached out for help since he was unable to cope up with the stress by himself. In his role as a peer supporter, AK immediately provided Ajay emotional support by creating a space for him to share his distress feeling and by acknowledging the violence he had experienced, while also reinforcing that he was not responsible for his family's violent action. So basically, this passage is just example about LGBTQ. One of the case of a person named Ajay who is LGBTQ. Not Ajay is a supporter here, peer supporter who help a person, a child, a young girl who just traumatized by his family violence or abuse. As Ajay is already experienced that, he just immediately reached to him and support him that to just cope up with that particular situations. So we can't just put anything from here. Is that just it's an example? We just understood that how those things are working, how the support groups are working. So let's moving toward the next pieces. After assessing the intensity of Ajay's suicidal thoughts, AK provided him with the reassurance and hope by helping him identify his internal strength and potential solution to deal with his situation. AK also gave Ajay details of referral contacts for legal and financial support to help reduce his dependence on his family and prevent any further instance of violence. Iki continued to provide emotional supports and followed up with Ajay regularly until he was no longer at a risk of suicide in better state of mind. In this way, Ajay overcome his suicidal thoughts and was motivated to find a way to overcome his difficult situation. So here the further extension of the above example that how AK helped Ajay even after that day where he just supposed to commit suicide. AK provide him the financial help, some financial support, so that he are no longer dependent on his family. Further that here he is keep in touch with Ajay so that the thought of suicide completely removed from his mind. So that's all for today. Hope you guys will see you tomorrow with another series of this particular Eon topic. As of now, have a great day.